Thank you, Cecilia, for introducing me. So my name is Maria Wärn, and I work as a registered nurse at the Department of Endocrinology, Metabolism and Diabetes in Karolinska University Hospital in Stockholm, Sweden. And I have no conflict of interest. Working at a ward for outpatients means a lot of paperwork. We schedule the doctor's appointment, we send out appointment notifications, and we deal with several different quality registries, and we sit a lot in front of the computer. But most of all, we interact with the patients, and that's, of course, is the most fun part with work, the best part and the most rewarding part. In my work, I meet all the patients with acromegaly at the clinic before and after treatment. For blood samples, OGTT, growth hormone day curve, patient education, injections and counseling and so on. And at the ward for outpatients, we have 5,500 patients. And of these, there's 2,000 patients with pituitary disease. And out of these, there are 200 with acromegaly. And I am their main contact person before and after treatment. And all the patients can easily get in touch with me because they get my direct phone number. They have a rare condition, as we have heard a lot of us speaking about today, and the diagnosis can be difficult to accept. Almost everyone have a lot of questions, so we need to find time to create a relationship or a partnership with the patient. A few of these patients I have the fortunate to have more regular contact with for a very long time. And I would like to tell you about one of these patients, one of these 200 patients. And his name is Thomas. He is born in 1964. He lives a very healthy and active life. He has always something going on, and he's always in the center of any situation. He's a bit hyperactive. He's self-employed and working with leadership and media training. He's not married and is living alone with 2 cats. In May 2007, he went out for a drink with a friend that he hadn't met for a very long time, about 20 years ago. And the friend commented on his altered features, that she didn't recognize him. He looked different. He had a more prominent chin than she remembered. And he had a bit of a slurred speech. He did not give this much of a thought because he always considered himself as a healthy and well, he didn't feel ill at all. But he had just been diagnosed with a bipolar disease and was put on lithium. So he thought that maybe it's the side effects that makes me a bit swollen and it make me have the difficulties to speak. But on his friend's recommendation, he went to see his GP, but mostly to please her. The GP probably suspected that he had acromegaly. He took some blood samples and he went for an MRI scan. The IGF-1 was 1,300 micrograms per liter, and the MRI scan showed a pituitary adenoma. There was a macroadenoma. But the doctor didn't tell Thomas about this suspicion. So a few weeks later, Thomas got a letter. And the letter said, "I have tried to get in touch with you on your mobile phone, but since you didn't answer, I now send you this letter. You have got acromegaly, and I have sent a referral to an endocrinologist." And Thomas, of course, didn't understand anything of this. Most have no knowledge of this disease or what an endocrinologist does. So he Googled and found out that he had a brain tumor, that he had brain cancer, and he was going to die. This turned his life upside down, of course. Regardless of the bipolarity, he had never felt ill, he had a very active social life, he was working maybe a little bit too much, he liked to go to the gym, working out, because he built a lot of muscles. He was quite big. And he was a soccer and floorball referee. And now, of course, he was extremely anxious of course, because he didn't feel ill. How can he have cancer? At his first visit to the endocrinologist, his medical history showed that he had quite a lot of signs and symptoms. He was sweating a lot. He had to have an extra shirt with him to work. He had joint pain, and he was related that to it could be just muscle soreness after a soccer game or working out. He had increased foot size and increased ring size, and he also thought it could be because he was getting bigger because he was training, working out. He had a lot of body hair, and he hadn't got. Now at 2007, he didn't have any on his head, but only on his body, and he was thinking it could be an age thing. And he had no libido. He was thinking he was working too much and he hadn't any time for dating. And he had really big hands. But so did his grandfather and his great-grandfather. So he didn't reflect on that either. He actually used to tell a story about his great-grandfather's hands, who were actually cut off and put in a jar, and still is in a museum somewhere in the southern Sweden. I'm not sure that it's true, though. So at the doctor is presented him with the alternatives for treatment, and he was told that surgery is the first-line treatment. But he refused surgery. He was absolutely convinced that he would not wake up after surgery. He was sure that he was going to die, and since he already had this brain cancer, he was supposed to die anyway, so why should he do that on the surgeon's table? So he was put on somatostatin analog in July 2007, and this was the first time that I met Thomas. At this time, we always started up the treatment with short-acting octreotide to determine whether the patient tolerates the medicine or not. So when he came for his first visit, it turned out that he was really afraid of needles. And he had some really bad experience earlier with the blood sampling situation. He was afraid of the pain, and he couldn't see the sight of blood. So he didn't really look forward to this appointment. He was very insecure, of course, very worried and anxious, and had a hard time accepting this diagnosis. He needed a lot of information and education about the diagnosis and treatment and complications. And then there was this fright of needles. It was a struggle, but finally he learned to administer this octreotide subcutaneously. And it was a struggle because his hand was so big, and I don't know if you have the same glass vials that we have, extremely small. So I'm not sure that the compliance was 100%, these 4 or 5 days that he had to take this 3 times a day. But then he started the long-acting octreotide at 20 milligrams every 4th week. And he was also a little bit low on testosterone. He had 6 nanomoles per liter, so he was put on a long-lasting dose of testosterone every 10th week. So we met regularly for the injections and monitoring blood samples, and had a lot of time talking about the disease, the signs and symptoms, and other treatment. And Thomas struggled a lot with the thought of surgery. The patient often feel that no one, including the doctor, family and friends, understand what they are experiencing. So as a nurse, you have the knowledge about the disease, and hopefully you can try to give the understanding and compassion. We don't have any psychologists at our clinic, which we should have, of course, because Thomas clearly needed to talk about this. So we talked a lot. In 2008, in October, he finally decided to go through with the surgery. And then his IGF-1 was 744. He had the transsphenoidal surgery at the neurosurgery clinic at Karolinska University Hospital. And he did wake up after the anesthesia. 8 weeks post-surgery, the IGF-1 was 495. And he was doing really well, and the IGF slowly decreased during the following months. And he had less symptoms. But in May 2009, he again started to feel symptoms like difficulties with his concentration, he had a slurred speech, he felt swollen, and he was exhausted by just a little effort and sweating a lot. The post-surgery MRI showed a small tumor rest of 5 millimeter, and the IGF-1 had now increased to 581, and the testosterone was still low. So he is back on octreotide, long-acting, 30 milligram every 4th week, and we shortened the intervals of the testosterone to every 6th week. And he started to feel better again. At this time, he had a lot more knowledge about acromegaly, and he was very active in the patient organization, and he had decided to try to use his appearance in a positive way to enhance his quality of life. He had seen an ad for casting to a TV commercial where they needed a caveman with lots of body hair. So he starts to do some acting in TV commercials, and extra in short movies, and as a participant in comedy shows like Candid Camera and practical joke shows. And he mostly plays a character who's really angry and scary. But of course he's still anxious, and he's afraid that the adenoma is growing. And he's very sensitive for signs and symptoms and changes in his body. And in May in 2012, the IGF-1 has increased again, and he starts to feel that his tongue is swollen, and now he's quite dependent on his speech more than before. So he's really anxious about this. And he's very tired, he's gaining weight, and he has problems with his sleep. So it's decided to change the somatostatin analog from octreotide to lanreotide. So he's put on lanreotide 120 milligrams every 4th week. And lanreotide, as we have told here before, is possible for the patient to administer himself. Due to his fright of needles, he wanted to do this. So he didn't have to come to the clinic every month. So after a couple of months, Thomas started to inject himself the drug, and he has gotten over his fright of needles because, as you know, the needle is not small. So now he is in biochemical control. He has an IGF-1 at 200 micrograms per liter. And we still meet for the testosterone injections. And he is now lecturing at the Karolinska Institute for the medical students every semester, and have been done for a couple of years. And he's very active in teaching others and educate others about the disease. And he's very keen on telling everyone how it is to live with such a rare disease and with the treatment for the rest of your life. And he's less anxious, but he's still very aware of that he had this rest tumor, adenoma. And he also has his mindset on being the face of acromegaly in Sweden. So if you meet him at the supermarket, he would be happy to tell you everything about it. And he is very generously letting me use his private pictures. So I would like to end this with showing his private pictures to show the gradual change in facial features prior to diagnosis. So this is Thomas when he's 14 years old. And here he's 17 years old, and you can see he has a big hand, but probably The tumor hasn't begun to grow yet. This is how his friend remembered him when they met in 2007. And here is Thomas, he's 28 years old, and this is when he himself can see that there's been a change in his features. So he's getting less and less hair on his head, but still a lot on his body. And this is Thomas at the time of diagnosis. And in his work as an actor, he could look like this, angry, scary, or a bit goofy. And this is how Thomas looks now. So thank you for listening.